guys, Dr. Anjana Bhana here, and welcome back to my YouTube channel. Today I am super excited. We are at a Train the Trainer session here in Bryanston at one of my aesthetic besties practices with Dr. Job Thuis from the Netherlands. He is doing our training for a product called Radiesse. Radiesse has been around for almost 20 years, FDA approved, CE marked, and it's actually been in the country before. It went out for some distributor issues, but it's an amazing dermal filler as well as a biostimulator. So it's a super versatile product. And, Dr. Thuis, where exactly in the Netherlands are you from?
Actually from Amsterdam, the capital of the Netherlands.
Okay, and then you have a clinic there. You guys just rebranded, right?
Correctly, yeah. So maybe a few of your colleagues, doctors, know us from Doctors Inc. The past was the name of the clinic, Fall Clinic, but now we're called UMA.
Okay, so why the name change? What does UMA mean?
Well, UMA is a little bit the new rebel in the Netherlands, because we like to see things differently a little bit nowadays.
Okay.
Especially if you talk about aesthetics.
Yes.
It's been more being true to yourself.
Okay.
And not just create the looks that everybody's expecting. Right?
Okay. Okay.
So it's more about listening to yourself, what it is the patient really loves, and then together create a plan, and that's UMA. UMA is the new kid on the block.
Oh, that's very cool, because there is a big shift to diversity in aesthetics, and not diversity only with ethnicity and skin color, but also now personal preference. Because when we first started, it was very almost cookie cutter. The lips must be this size, and the cheeks must be this way, and that everyone has to look very, very similar. But you also have a training academy, right?
Correct.
So is that called the UMA training?
Yeah, so we have the UMA Institute.
The UMA Institute, okay.
And within that UMA Institute, we have the clinic, UMA Clinic.
Okay.
The UMA Academy, where we get doctors from all over the world to get trained in safe techniques.
Mm-hmm.
And the UMA Research Department, because as you know, it's also so important to do good research on the treatments that we do in aesthetics. Yeah.
So you were talking about now recently in there, you were talking about a paper about aspiration. I know it's a very controversial topic about oscillation and aspiration. So that's one of the papers that you guys did a bit of research on. Okay,
yeah,
all right.
I think we already published more than 20 or 30 papers. Papers on aesthetics. Yeah.
Okay, all right.
My dear colleague Yanni, I mean, he got his PhD in aesthetics.
Oh wow, okay.
So so we really find that doing research is something that belongs also to a good aesthetic doctor.
Yes, yes. And then tell me now, with Radiesse, it's been, so this is 2022, and in South Africa, it has been one launch after the other with biostimulators. So, and I know Radiesse is actually a more versatile product than just a plain old biostimulator, but what sets Radiesse apart? What is Radiesse actually?
Yeah, so Radiesse, the substance is calcium hydroxyl apatite, right? Which is a human mineral.
Mm-hmm.
That means we're injecting something that is exactly the same as than in our body.
Yes.
That makes it really safe. There will be no immune response. If you compare that with hyaluronic acid,
yes,
that's cross-linked. It's changed, so there will always be a reaction of the body. Radiesse is it's a gel, obviously, so we can use it as a projecting filler.
Mm-hmm.
We can do volumizing with the product. We can give definition because there is no water attraction.
Yes.
Yeah? Which is for me one of the most important things to use Radiesse. So if you do a cheek with Radiesse, you will not have the round hyaluronic acid cheek.
Okay, you have more definition and sculpting.
Yes, exactly.
Okay.
It's more like you create the bone structure than that you create the round, full, fatty cheeks.
Yes.
But if you dilute the product, we can make it a skin booster.
Okay,
yeah? So you can personalize it. It's so versatile. Yeah.
So it's great for guys who, like, male aesthetics is very, very big. I think over 10 years there's been an over 200% increase in male aesthetics, and so guys like definition, jawlines, other thing. But like Job was saying, that it's also a little bit of a move away from the very drastically, like Thanos dark side jawline, you know, like a cash register. What do they call it? Texas jawline. So a bit of a move away from that, but still excellent definition and excellent lifting. And in a dilute form, it acts as a skin booster. So a skin booster improves skin quality. So for crepey skin, acne scarring. And the cool thing is it's not just for the face, for the body as well. So necks, like loose tummy skin, cellulite as well. And then I know like the big other stimulator here in the country at the moment is Sculptra, so you know, like a Brazilian product. So different, how is it different? Like what are the differences now?
Obviously it's a completely different substance.
Yes.
Right? And Sculptra, I mean, it's a really strong biostimulator.
Yes.
And I mean, we use it in the clinic as well. So with one box or one product, you can use it in different ways.
Yes.
So you can create projecting, but also use the same product for biostimulation. So Sculptra is a really strong biostimulator.
Yes.
So you have to be a bit more careful if you ask me. But that's why doctors are diluting it more nowadays.
Yes,
Because, but it has some similarities definitely, but more differences than similarities.
Okay, and that's the cool thing, especially now budget conscious patients, because from one box, one or two boxes, you can have a skin boosting treatment as well as a contouring treatment in one treatment. And the name of the game now is combination. So also safe to go with the hyaluronic acid. So if you have your traditional dermal fillers from Allergan, Galderma, whatever you prefer, or Merz, that's a Radiesse product, you can combine them in the same session. And then, like, you know, we're talking about granulomas and nodules. So what's the difference between a granuloma and a nodule? And where does this, it's fear mongering and it's marketing, of course. So there is a, with the other biostimulator as well, they have like a, what's the word? A reputation for nodule formation. But we know that's not true. So if you can like talk us through that a little bit.
Well, there is a big difference between nodules and granuloma.
Oh, yes.
Right? So a granuloma is always because of a foreign body reaction.
Okay.
So if you inject something, it will be a reaction of the body and it will be encapsulated. Then you have a granuloma. That will not go away by itself. It has to be removed surgically or with some injections. But with Radiesse, there will not be a foreign body reaction. Yeah, because we're injecting a human mineral.
Yes.
So if you have a problem and you feel palpable product, it's not a granuloma, it's a nodule. And a nodule is just product clustering together. But the product will disappear, so the nodule will also disappear. Yeah, but it can take quite some time. So that's why the injecting techniques are so important.
Yes.
Yeah. So with Radiesse, there are no granulomas reported.
Okay.
Yet, except in some areas where there was also HA injected.
Yeah, so that's really important. There have been over 200 studies with Radiesse, over 20 years of use, well, almost 20 years of use. And just a quick difference. So a nodule is technique related. So it's related to the injection technique where too much product is in one place. And a granuloma is your body's own reaction to the filler. And because of the cross-linking, the BDDE in cross-link fillers, sometimes your body reacts to it, especially with, you know, nowadays with vaccines, with what's going on in the world. There's a lot of like immune disorders. So when you go for a treatment, and even if it is, you know, Radiesse, a safe product like Radiesse, it's important that you have a thorough, you know, medical examination and consultation, because a lot of people see this as beauty treatments, but it's actually a medical device and it's a medical treatment. Dr. Job, thank you so much for your time, and I'm super excited. We're actually going to do some injections on patients in a little bit, and yeah, but I'm super excited. So thank you for coming all the way to South Africa.
Pleasure is all mine.
I hope you enjoy yourself with the short time here. We hope to see you again. Thank you.
Inferior border, superior border, entry point in the middle, and from here to the modiolus is my vacuum line. So do some fanning here, some fanning here, and then the angle like this. Ligament here, entry point here, do some fanning here, just to give support. And with this combination of doing this, this, and this, you can create nice sharpness in the jawline. 0.3 here on the lateral frontal concavity, 0.3 here, so then it's 1.2, so then it's not a syringe. Yeah. Okay. I always anesthetize my entry points, so always disinfect the hair as well. right? Because we're using cannula, so we have to be a bit more vigorous with our disinfection than with a needle. It stays already clean, so. Okay. The entry points, you get the sensation of the cannula going back and forth is not really nice, so I'm not sure what kind of needles you use for your toxin. Okay, so I just do a little bleb. 1, 2, 3. 1, 2, 3. Sorry, this is the painful part. 1, 2, 3. 1, 2, 3. Okay, maybe a little metalis block. 1, 2, 3. One in the midline. 1, 2, 3. Okay. 1, 2, 3. Sorry. Okay, keep breathing. Okay. 0.3 of xylocaine with adrenaline. Xylocaine with adrenaline, yes. 0.3.
Okay.
And the classic Radiesse. Okay. Do a lock connector, and then I shoot the Radiesse in. Yeah, and then I just mix this properly. Yeah, just 10 times, something like this. Okay. As you can see now, I have 1.8 of product. Yeah. And obviously 0.3 will be absorbed, so it's so it's mixed. So normally I take half of it, 0.9. So I use 0.9 on this side, 0.9 on the other side. Yeah. You can see there is a lot of elasticity. Yeah. So this is 0.1 of product. Yeah. So there is elasticity. You can feel it. Just put your finger in. Yes. Yeah. Just yeah. Okay. Yeah.
Okay.
Yes. Yeah. This is Radiesse Plus. Yeah. So 0.1 as well. So it's a bit stronger. Understandable, right? Because it's powder lidocaine, it's no liquid lidocaine. So it's more strong. Let's start. So I've anesthetized my entry points. The entry points I only make with my bevel of the needle. Because I see doctors going in, like opening the hole. It's completely not necessary. You only bruise people. So I just use my bevel, 1, 2, 3, just to go through the dermis. That's it. Yeah? Through the dermis, that's it. Through the dermis, that's it. Is that okay?
Are you in?
Yeah. Okay.
Yeah.
Good.
Oh, wow. You made the pricks.
So, just with the bevel, 1, 2, and 3. Okay, good. Yeah. So I lift my cheek, feel resistance, smas, and I have to have a click. Click. Now below the smas, I haven't touched the periosteum, but I can glide on top of it. You can see, this is a gliding plane on the periosteum, so I'm not touching the periosteum. It's not necessary. Yeah. It's an easy gliding plane on the periosteum. Are you okay?
Yeah, I don't feel a thing.
Good. The deeper you go, the deeper you go, obviously, how less sensitive it is. Okay. To show you the ligament lift, and that can be a little bit sensitive. Yeah. I go back. Yeah. So I lift, and now I'm touching the periosteum of the lateral zygoma. Yeah. Tack, 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 tack. Okay. So I lift the cheek here. I keep my tip on the periosteum, and I change the direction of my cannula. Okay, and then there are the ligaments. So I feel resistance. This can be a bit sensitive, Jackie. So 1, 2, 3, click. You can hear it, right? And I feel that the tip of the cannula is now touching my finger, and I'm protecting now the deep tissue here, because now I cannot go into the transverse artery. I cannot go in the parotid gland. So what I do, I just do a few drops of 0.05, 0.05, 0.05. I go out, and then I release the cheek again. And then there is a bit support below with just 0.1, 0.15 of product. Yeah? So that's where I start with. And then we go back to the lateral cheek. So click, and I am on top of the periosteum. I feel where the tip of the cannula is, because that's what we need to know, of course, yeah? So I lift the cheek again a little bit, I do a bolus, 0.1, and a small retrograde. Again, 0.1. I advance my cannula again. Where is my tip? It's right here, yeah? So I lift the cheek, 0.1, slowly, retrograde. Okay. That's, I mean, she has good cheeks, so we don't have to. And what you see is what you get. Yeah. So this will not become more round, or maybe she needs a little bit more hair. You okay, Jackie?
Yeah.
So now the tip is right here. You see how it comes up? So we can already see how that nasolabial fold is lifted without even touching it.
Thanks guys, and thanks for joining me once again. Any questions about this or anything else we do, drop it down in the comments, like, share and subscribe.